Supine thigh-supported internal rotation stretch. In the supine thigh-supported internal rotation stretch, the client will, of course, lay supine, face up. Grab the client's leg by lifting the leg and then placing, if you're facing towards their head here, you're going to be placing your inside arm underneath their lower leg, kind of like a headlock, except for you're not going to grab that strong, okay? It's just going to be just enough to support their thigh. Then with this outside hand, you're going to place it superior to the lateral knee, on the inferior portion of the lateralis there. Then you're going to grab your own wrist. Then what you're wanting to do is have the client's thigh and hip here being about 80 degrees of hip flexion, but not 90. Depending on the client, if you do this stretch and you're 90 or like in 100 degrees of hip flexion, it's possible you're going to create some hip impingement. In fact, you'll want to be cognizant of that and ask your client if they feel any impingement in their hip when you're applying this stretch. Place the hand again on the lateralis, grab your own wrist, and you can actually use your body here gently as you start to rotate their femur. And I'm going to get out of the way here so you know what the grip is. What I'm doing in that hold is I'm rotating, and Matt has really good internal rotation, as you can see here. This would be applied for clients who have limited internal rotation. So as we go out, we're going into internal rotation. The thigh is rotating to the inside, the lower leg's coming out, but the thigh is rotating in. And so we're going to be really gentle with this one. This is not a hamstring or contralateral hip rotation stretch where it's a lot of soft, strong muscle, contractile tissue stretching and connective tissue stretching. This can get into the joint quite a bit, so you want to be really cautious with how intense. I would advise you not to go past a 5. The 5 would be a high side, 4 to 5 would be really ideal for this stretch. So as you go into the stretch, ask the client on a 1 to 10 scale, how much stretch do you feel?
4.
Okay. And again, 4 to 5, 5 being the max, absolute max on this stretch. And again, this is the kind of stretch, make sure your client's communicating with you, telling you 1 to 10, and they understand what 1 to 10 is.